Community delivered services. Safety.
Because if your staff don't feel safe going out, then the work can't happen.
People have lots of thoughts about safety and work in the community. We talked to professionals from across New York State who all deliver services in the community to get their tips about how to stay safe. Of course, people share basic precautions. No flashy jewelry, stick with comfortable clothing, and avoid wearing shoes or other clothes that make it difficult to move quickly. But let's hear from some of our experts directly about working in communities.
Most of the people that we're working with are living in substandard housing in neighborhoods that aren't particularly safe. And so we spend a lot of time making sure our care managers understand and are able to assess those situations.
You could be walking into an apartment that's taken over by drug dealers. You could be walking into a building that's not safe because it's an impoverished community with people coping in different ways, and some of them might not be the healthiest. You might be a very clear, standout type of outsider. Also might make you feel unsafe just because based on your level of discomfort and unfamiliarity.
Frequently in the news, you'll see issues of things that happen in the subway and on buses, and even just having people traveling by public transportation. And so we started to talk to the staff about what happens in those situations as well, because they're still working for the company, even though they're not in a client's house. Because when you have people in the community, they're not coming back into the office to check out. So we started implementing a text policy where people would text to say, I'm done for the day, I'm going home. And then if they forgot or they didn't, the supervisors would reach out to them and just say, just checking to make sure you're okay.
Right. We also heard some good advice about how to promote safety when visiting clients in their homes.
We train people to ask, is anybody else home when they go meet with somebody in a home, so that there's not, there could be somebody in the back room that we don't know about. Maybe the client doesn't want that person to overhear certain things. The person could be a danger. So we just want to know that kind of thing.
Make sure you know what kind of animals perhaps they have, and that there's a plan for if their animal isn't particularly well trained, that the animal is put where you can safely meet with the person. Most of the time people are worried not so much about the people that we're working with, but the people around them. It's the neighbor that you have to worry about, or the roommate, a mother, a family member. Generally, if we're treating people with respect, we're not having issues with the person that we're working with. But again, it goes to that assessing of the environment.
We also ask staff to look for a hard seat to sit on versus sitting on a sofa or something where there could be needles or something underneath.
Out of all our conversations, what struck us most was the importance of two simple things. The first was information sharing. It may not be exciting, but everyone involved with a given client should be routinely sharing information with each other. If you're on a visit and you notice your client is upset, share that information with others on the team so the next time someone else goes out, they are prepared. The second thing mentioned was routines. There are many different routines to follow, such as making sure your cell phone is fully charged, or there's gas in the car if you're driving, making sure someone in the office knows where everyone is, having a check-back routine at the end of the day. Ultimately, each program comes up with their own routines, but experts agree that routines are key to safety. To summarize, to promote safety in the community, staff should be continuously assessing safety and risk, sharing information, and following safety routines. Thanks so much for listening.